Welcome to the ANEW Insight Podcast, empowering and inspiring your journey to optimal health. Hosted by Dr. Supatra Tovar, clinical psychologist, registered dietitian, fitness expert, and author of Deprogram Diet Culture. Rethink your relationship with food, heal your mind, and live a diet-free life. I follow my guests' journey to optimal health, providing you with the keys to unlock your own wellness path. Tune in and evolve with us. Welcome back to the ANEW Insight Podcast. We are back for the second half of our interview with trauma survivor, healing innovator, and mental health trailblazer, Brad Silberman. Welcome back, Brad.
Thank you. Great to be here.
Brad gave us some insightful perspective into his painful journey from trauma to thriving. I cannot wait to pick your brain some more. Are you ready?
Always.
Okay. So we started to talk about ketamine therapy. And that, I think, is a little bit controversial, especially since what happened with Matthew Perry. But just give us an insight into what inspired you to create Rewire, and how does that help people struggling with their mental health?
Okay, so I was afforded the opportunity of being CEO of ketamine clinics last year in Los Angeles. And I just saw how it helped people. It was amazing. Unfortunately, the clinics closed down just due to various reasons. And I had a calling or a responsibility, really, to provide those patients with something better, in my opinion. I saw how amazing it made their life when they were on treatment. And now the clinics had closed. So I had an idea to bring it to their homes that creates a more accessible and convenient approach and safe approach to providing them ketamine therapy. So I put it all together, and it took me a couple of months to really get it going, find the relevant clinicians and the doctors and the operating structure, and now it's operating and helping people. So I'm very grateful, I'm proud, and it just felt right because of my journey, of me really having that non-medicated psychedelic experience, me dying and coming back and seeing the other side and seeing this side. I kind of just felt right, to use what I was here for, to really make it count for people. Because a lot of people are struggling. Everyone has challenges. And I think the data suggests that in California alone, there's nearly 10 million people that were diagnosed in the last year with treatment-resistant depression. Wow. So, that's a huge amount. And this therapy helps.
Go through the process. What does it look like if they're coming into your home? And just take us through what the experience would be like.
All right, so should I tell you what's currently out there?
Yes.
And just so we can just explain the difference?
Yes.
So what's out there are clinics, right? Clinics that cannot be everywhere because they're clinics, right?
Yeah.
So they're not close to every single person's house or workplace. They are only open during working hours, okay? So first of all, people to get to a clinic often takes a long time because they're not nearby, okay? And they can only go during working hours.
Right.
So if they're working, they can't go.
Right.
Often when they do go to clinics, they have to be driven because they cannot drive after the ketamine therapy. So they either take an Uber for an hour or half an hour or 2 hours, or they get their spouse, mother, friend to take them that has to wait with them for 2-hour treatment and to drive them home. So it's not convenient. In these clinics, okay, there's an FDA-approved and insurance-backed product called Supatra, okay? So you need a good insurer to cover that, and you have to still pay a copay often, which is often expensive. Sometimes, I think the average copay that we experienced was about $80 a treatment, on top of the payment, the premium. Then you have the IV or IM, intravenous or intramuscular ketamine at these clinics. The average cost of that is about $700 a treatment, which is pretty expensive for the masses.
Yes.
You have at-home therapy, which is a sublingual lozenge or troche. Okay, it's a great way to provide ketamine to people. But the problem, I believe, is that it's not safe. It's not monitored.
Right.
And the inclusion criteria is not stringent. Okay, so what's happening is people are misusing and abusing it. You know, that's what happens with society, unfortunately.
Yes.
So I saw this and I decided or tried to make an at-home therapy model where it's accessible, it's affordable, and the safety piece was missing. So the at-home ketamine is great because it creates that accessibility and potentially the affordability. But the issue that I had with it is that it didn't provide the safety mechanism of this controlled substance.
Right.
So people started misusing and abusing it, and things started happening negatively. Okay.
This is if they if they were going to just get ketamine off of the street or from wherever.
No, that's like kind of recreationally street ketamine,
Okay.
No, this is from ketamine companies that are in this the same way we are in this to help people. But there was no
monitoring
of the actual ketamine of the treatments.
I see.
So they would have an assessment, okay, which was either stringent or not stringent, and they would deliver a whole bunch of ketamine to the person's house. And that allowed that person to misuse and abuse it, either with friends at parties or take more than they should, etc.
Yes.
Okay. So the whole concept of Rewire is the priority was safety. How do we create something, okay, that someone cannot misuse and abuse it, and that it's monitored for every single treatment? So we set up a protocol that enabled that. Okay. So first of all, there's this very stringent inclusion criteria with a psychiatric evaluation on video to either approve or reject a patient based on safety. Is this safe for you? And will this benefit you? Are there other options? Okay?
Yes.
So if it all makes sense, then we will send to you a technology-enabled blood pressure machine, okay, which connects via the cellular technology to us at the back end. So our nurse on the back end can see your vitals in real time.
Good.
So before treatment, they check their blood pressure. We approve their blood pressure for the treatment, okay, and then they have the treatment. After the treatment, we check the blood pressure again to make sure that it's stable and everything is great, and then we discharge them. So that's one element. The second one is that generally ketamine is dosed based on weight, on how heavy you are, right? In my experience, very large people have had too intense of an experience from a little bit of ketamine.
Wow.
And very light people have no interaction or experience with high doses of ketamine.
Wow.
So we got a titration initiation session where the first time that you have the treatment, we are on video with you, our psychiatric nursing practitioners, to understand your exact dose.
Wow. Good.
And that's the landing dose. We also only deliver very minimal amounts of ketamine to the person's house, so they cannot misuse or abuse it. So that's why that's really our differentiator, and that's a model and protocol that we're very proud to have built and developed.
Yes.
And it is helping so many patients because they feel that we are walking with them hand in hand throughout their journey. There are post-survey assessments. So after every session, there's a post-survey assessment to see how it was, if we need to change the dosage. And there's obviously the depression and anxiety questionnaires throughout the process. So we really walk hand in hand with every patient to make them feel comfortable, secure, and that we're really with them.
Okay. And so your outcomes with those questionnaires show an improvement in depression and anxiety post-treatment?
Yes.
Oh, I love it. That's awesome.
We've had people that are like, can't believe how it's helped their life. They can finally go out not worry about things that previously worried them, have that anxiety, panic attacks.
What do they report as the experience? I mean, does it vary widely? Do you go
Like
into
during
that?
treatment?
Yeah, when they're during treatment, what do they report that they experience?
So again, it's different for every person and every treatment, actually. I think there's more to the actual treatment than the treatment and dosage itself. I think it's all about the intention for the treatment and how you prepare for the treatment. So if you eat, for example, a huge steak for lunch, and then an hour later you go into treatment, it's probably not going to you're not going to get the effects as much as if you don't, or not the effects, but you probably wouldn't get to that disassociative state that you would have if you didn't. Do you know what I mean? And the intention that you set for that treatment, that's really important, we believe, because it kind of gets you to a place that you're actually looking for, instead of just going there empty-handed or blind.
I see. Do your practitioners help them get into that intention, and how do they do that?
Yes, well, before every treatment, we recommend breathing techniques. We recommend setting your intention for the session, and they go into it, and they have experienced a much greater symptom reduction.
Wonderful. So I want to go into the controversy just a little bit, especially with Matthew Perry. He was he had taken ketamine at his home, I believe.
Yeah.
What do you know about that, and how does your treatment differ from what his experience was?
Well, first of all, it's a real tragedy.
Awful.
It's horrible, and these are the reasons which make us really have that safety protocol in place.
Yes.
So once we get the landing dose of the ketamine, we only use that landing dose, which is still a minimal amount. So it's a low dose of ketamine. Okay? It takes people, depending on what they're doing and how they're doing it, to a disassociative feeling where they can remove themselves from this tangible world and go into another place where they can connect with their heart and their emotions and really get through things, right? But that's not the goal. The goal is to reduce the symptoms that they're experiencing.
Right.
So the amount of ketamine that we send to people is very minimal compared to what Matthew Perry had. And we also recommend and suggest that every person on treatment is actually with someone in their home, either a spouse, a friend, a partner, a caretaker. And that's the difference, where we have their number and we're interacting with the caretaker. So I believe that Matthew Perry was actually in the bath.
Yeah, he was in a hot tub.
And he overdosed. He took too much ketamine and
Drowned.
He went into he fell asleep.
Yeah.
Like an anesthetic. And that's what happened. So we try to prevent that with allowing, or suggesting rather, that there needs to be someone in the home with the patient. And if they are not, they sign a waiver and disclaimer, and either our nurse is on video with them. On top of that, we're always assessing their blood pressure before and after. So we kind of only discharge them when everything is good. And if something's not good, then we intervene and interact.
How do you intervene if something does go wrong?
Something goes wrong, we have nurses on the phone dealing with either the caretaker or the patient. And if we need to call ER or take them, or 911, or the companion takes them to the ER, and we always stay in touch throughout the process.
Okay. Has that happened?
No.
Okay.
So
Thank goodness.
Yeah, thank goodness. So we try to prevent that as much as possible because of the stringent criteria and the protocols of inclusion, and the fact that we get the exact landing dose per patient, and they can't do more than that.
Yes.
And there's only a minimal amount of medicine with them at once.
Ugh.
So
that's so good. And are you an innovator as far as this treatment? Are there other companies doing the same, or most of them done in clinic? So
like I was stating before, there are clinics that do it, And that's probably the safest route to do this, because there's a nurse with them, and if anything happens, they can be there.
Right.
But that's the accessibility problem. It's the working problem and the cost. The at-home ones, they generally only send through the trochee, the lozenge, and it's not monitored. I'm not sure if any other companies are doing what we're doing, but as of right now, I think we are the only ones that are offering that support and that safety mechanism of checking that the person is good before treatment and is good after treatment before we discharge them. And if they're not okay, we stay with them and keep on the phone with them or their companion, whoever's in the house with them, and we direct them accordingly with obviously a medical professional.
That's wonderful. I think it's really lovely for them to have that option to do it safe and at home. And I can relate just slightly. During COVID, everything went to telehealth for therapy. And all of my clients were resistant about doing therapy from home. And then when they realized how comfortable they were, and they could have their dogs with them, and they could be in their pajamas or wherever they needed to be that was safe and comfortable for them, none of them have wanted to come back to the office.
I know.
None of them have wanted to drive in traffic. They can do therapy from anywhere, and they love it. So I'm sure that you have a similar
people are loving it in terms of, people are doing treatment at 7, 8, 9 at night. And as long as we have scheduled the relevant nurse to be monitoring them through it, then it's all good. And they can have a great night's sleep after they've been discharged, and have a great day the next day. Wow. So it's after work, it's people that are working, people that can't get to a clinic or get someone else to take them to a clinic and wait 2 hours and take them back. Patients are experiencing great stuff.
Wow. So you're really just paying it forward in so many ways. You experienced this helped you heal. You did it in a non-psychedelic way, but through all of your treatments, through all of your therapies, that's become your goal and your mission, is to help others recover like you've recovered. So give us a picture of all of the different types of mental disorders that can be treated using ketamine therapy. We talked about anxiety and we talked about depression. What else is there?
So the main one is actually treatment-resistant depression or major depressive disorder. So it's depression essentially. And together with that, it helps anxiety, trauma, PTSD. It also helps with pain. But pain, the recommendation is to go to a clinic because it's a much higher dose and it's a much longer treatment. But they're studying what ketamine does for amazing things. They say it's a miracle drug. Yes. They're studying it for ADHD.
I was just going to say, I wonder if it's good for that.
Yeah, for people that are born with mental problems. And it could really benefit the world.
I wonder about OCD.
Yes, they're studying that for everything you can think of.
Eating disorders.
They're studying it. It's just the data is not there yet for us to treat those symptoms.
Right.
So we're focusing really on depression and anxiety and trauma with the depression.
Does it have to be treatment-resistant depression, or can it be used in conjunction with talk therapy?
No, it can be used, definitely. So talk therapy, I'm a huge fan of talk therapy. Huge fan, especially because of my incident. Like if I had someone to talk with about my journey, about what happened, it would have got me to that place a lot quicker, right?
Yes.
I'm a huge believer, and we will include talk therapy shortly. Not right now,
Right.
we're first getting through this first phase, and we will include talk therapy with our package. Talk therapy is great. It's not required. The data suggests it's not required, and there's actually it doesn't have to be there in order for you to decrease symptoms because of that blockage of the NMDA receptor, like I mentioned previously.
Wow.
Yeah.
But you want to offer that.
Well, I think it just adds huge amounts of value. You go through something, you kind of have an epiphany, right?
Yes.
What do I do? How do I put that into my real life? So by having talk therapy with a professional can help you get there a lot quicker.
Oh, yeah. I can
So
only
that's
imagine
why
if
I
you
think
were to
it's-
process what you saw, what you experienced with a therapist afterward. I can only imagine the
Yeah.
effect would really be lasting. Do you see any regression with people? Do they do the ketamine therapy and then maybe months down the line or years down the line revert back to depressive states?
So our goal is actually to reduce the frequency and dosage of a patient for them to actually get off ketamine. But we have a model whereby when they push pause on the ketamine, we're still with them. So they still have access to our assessments. And when we notice their scores are declining with depression and anxiety, we recommend for them to come back for depression.
Wow.
So yes, life happens.
Yeah.
Life happens. Things happen. Things take us to another place. We can be so happy for 1 hour and the next hour so miserable because something happens.
Right.
So yes, regression does happen.
Yeah.
But like I said, we walk with patients through their journey. We hold their hands, and we with them, even when we're not treating them on ketamine, we still want to be with them and walk with them. And when they need us, we are there.
Without giving any details, can you give us a picture of your most remarkable transformation that you've seen with someone doing ketamine therapy?
Sure. Well, there was I think a 21-year-old person who could not get out of bed, was depressed, went on ketamine, and literally 2 weeks later, or maybe 2 to 4 weeks later, he had a job.
Wow.
And he was working and had a purpose. Another one, I think I mentioned earlier, that there was a lady, I think she's about in her 50s, and she couldn't leave the house. She was depressed about it, and she was anxious about leaving the house. She couldn't go watch a movie or go to the theater. And she's been on treatment for 2-3 months, and she's so happy, and she's going out and having dinner with her friends and with her spouse and going to movies and going to entertainment. And she's so happy, with this treatment. So,
Wow.
I mean, and that's why we're here. That's the reason why we're here,
So, is there anything down the pike for you? Aside from Rewire or connected with Rewire, are you out speaking anywhere? Do you plan a second book? What's next for you?
A second book, I would love it all. I would love to do it all. My mission, wherever I go, is to uplift another person. And like I said, that my commitment and responsibility for coming to America is to sit at the table that is presented to me. So this table is presented to me now, I'm here. If another one appears, I'm going to sit there. So where I can utilize my energy and my purpose-driven passion to help other people, that's where I'm going to be.
So tell our listeners where they can find you.
Where can they find me? Well, just my social handles are Bradley Dean 10. The Rewire Ketamine is rewiremenow.com, and the social handles are Rewire Me Now, and that's where you can find me. The book you can get on Amazon, Be the Bubble by Bradley Dean Silberman. And if anyone wants to connect with me, I'm here. Reach out to me on the social platforms, LinkedIn, and let's work together to uplift your life and mine.
I love it. I love it. If you could impart our listeners with one, not necessarily a piece of advice, or just a takeaway that helps them achieve the kind of mindset that you have, what would it be?
I think they need to get to a state where you love yourself more than anyone else. And that's not being egotistical. It's loving yourself before anyone else so that you can do what you need to do. Because when you have that mindset, whatever happens to you is okay because you love yourself. You don't need anyone to make you feel that you love yourself or make you feel worthy. You need to make yourself feel worthy because you are here. You are born for a mission and a purpose. And you were born to love yourself. If you don't love yourself enough, you're not going to love anyone else like you should or love anything like you should, right?
I love that takeaway. That's very beautiful. Well, thank you so much, Brad. I'm really grateful that you were able to join me today.
Thank you so much. I'm honored and privileged. It's been a pleasure. Thank you so much.
Wonderful. And thank you, everyone, for tuning into the ANEW Insight Podcast. I know I'm looking forward to the next interview, and I really do hope you join us next time. Thank you so much.
Thanks for tuning into the ANEW Insight Podcast. Please remember, the content shared on this podcast is for entertainment purposes only and does not constitute medical advice. You can find us anywhere podcasts are streaming, on YouTube at my.anew.insight and at anew-insight.com under the ANEW Insight Podcast tab. And follow us on our socials at my.anew.insight on Facebook, Instagram, TikTok, and Threads for more updates. Tune in next time and evolve with us.